Welcome to the four-part video series about diabetes and improving resident outcomes in long-term care, presented by Superior Health Quality Alliance. This video was developed for healthcare workers with an interest in providing care to individuals with diabetes residing in long-term care. This video will address strategies to improve diabetes management in long-term care settings and avoid hypo and hyperglycemia. You may watch each video in order or based upon your interest. The objective for this learning session is to achieve the following. Review effective strategies to reduce the incidences of hyper and hypoglycemia in long-term care facilities. Our goal is that after the video, you will have a better understanding of this topic and how it applies to you in your own healthcare setting. Hyperglycemia protocols in nursing homes are crucial. This goes back to the importance of having a diabetes champion who knows the process when someone has hypo or hyperglycemia. Having these protocols in place is like having a quick action team. They know what needs to be done and can act quickly. The sooner you can resolve the problem, the better the outcome for the resident. The Journal of the American Medical Directors Association studied a program where nursing homes took a three-part approach to train and educate staff, residents, and loved ones on managing the disease. As a result, episodes of hypoglycemia were resolved in roughly 75 to 90% of the cases without any follow-up problems. Just like with sepsis care, the quicker you administer that antibiotic drip, the better the outcome. Here's a link to download pocket cards for diabetes education from the ADA. The Diabetes Pocket Guide provides a quick reference to essential guidelines and recommendations to help in making informed decisions quickly, which is crucial in managing diabetes effectively and preventing complications. You should quiz your licensed staff as well. Can a type 1 diabetic benefit from oral medical medications? When should long-acting insulin be held? How many carbs should I give a hypoglycemic resident? Once I give a resident insulin, how quickly do they need to eat? And so on. You can download the new 2023 Diabetes Standards Pocket Guide for $5.95 from the ADA. There have been many studies to determine the best and most effective treatment guidelines. We have societies, associations, and other organizations who've put together the best practice recommendations. One question frequently asked is if sliding scale insulin is no longer recommended. Well, they haven't done away with it completely. The current literature for diabetes management in long-term care patients emphasizes individualizing care goals and treatments. Different acuity levels and treatment options need to be considered. A patient's diet, exercise level, and medications like corticosteroids can affect glucose levels. Guidelines recommend avoiding sliding scale insulin as the primary means of regulating glucose. The aim is to reduce the incidence of hyper and hypoglycemia in long-term care and hospitals. Previously, everyone was on the sliding scale, whether they were 90 years old and hadn't eaten in 3 days, or 40 years old with pneumonia. This one-size-fits-all approach doesn't work. The push now is for a culture change. The ultimate goal is to individualize patient care. The guidelines suggest using basal insulin, nutritional insulin, and correctional insulin instead of relying on the sliding scale. The key is to be proactive rather than reactive. Sliding scale insulin is reactive, adjusting based on high or low glucose levels. Instead, the focus should be on regulating blood sugar proactively. This has been a 40-year effort to gather data and change the guidelines. The takeaway is that while sliding scale insulin is still used, it's not ideal for patients as it can harm them. And the best way to change this practice is to educate our nurses, and other long-term care staff. In summary, here are some key takeaways from today's presentation. Diabetes is a chronic disease that affects every organ in the body, and it can impact the nervous system and circulatory system and impact your eyesight. With the proper training and education, nursing homes can be very effective in reducing or even preventing complications related to diabetes. Establishing protocols supported by evidence-based best practices is an important step to ensuring the best diabetes care. We have created a list of tools and resources that may be helpful to you to explore further what we have been talking about in this video series. We have provided these resources related to diabetes care and long-term care. However, care transitions can be used for any individual, not just those with diabetes. We would challenge you to ask questions about diabetes care management in your healthcare setting. Where are the gaps? Where are you seeing gaps in your processes or workflows? Are your residents experiencing hyper or hypoglycemic events? If so, what steps are you taking to prevent them? All of these questions can lead you to the development of a root cause analysis, action planning, or initiating a Plan, Do, Study, Act cycle. We challenge you to analyze your data and determine where there are opportunities for improvement. Here are additional evidence-based journal articles that have information and resources in them. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.